We had this fantastic lecture yesterday from Professor Tolosa in Barcelona, and I have borrowed some of his slides and ideas to briefly summarize what is new in this field. Parkinson's disease, as you know, is a disease that is very frequent, 1.2 million cases in Europe. The number is expected to double by 2030, and the reason for that is the change of the aging pyramid. As you know, the burden of the disease is high. There are 640,000 years lost due to disease or to earlier death. That's the figure about. And as you can see, among the costs of neurologic disease, which amount in Europe roughly at 400 millions total, Parkinson's disease is an increasing group of cost drivers. Here at the Congress, there were a number of new insights into the disease development. I think the most important message in Parkinson's disease is that very early alpha-synuclein deposits can be found in the disease. And the paradigm of Parkinson's disease has completely changed during the last 5 years. In the past, Parkinson's disease was for us a disease that starts somewhere in the brain. Nowadays, most researchers believe that it comes out of the gut, where the first changes take place, and then slowly ascends within the vagus nerve and probably also the olfactory system. And then we have a transmission from cell to cell, like in prion disease. And this explains the very typical cause of the disease, which can be a disease that takes 50 or 60 years in the extreme, but also sometimes very short. Therefore, this early alpha-synuclein deposition on the one hand and the prion-like transmission from cell to cell are very important aspects. But you can also clinically see this, and major progress has been made in this respect. This is from a paper of Annette Schraag from the Queen Square in London, and what she did was she looked at data from the Social Security and looked with which complaints patients went to the doctor before the first diagnosis of Parkinson's disease. And what you can see is that about 7, 8 years ago, before starting Parkinson's disease starts, you can also already see a significant difference with respect to depression. When you look at constipation, another risk factor for Parkinson's disease, you can see almost 10 years before the disease onset. So that is an important new news, and we do have new research criteria to catch all this. And it's a complicated paper, it's a very novel approach. We link clinical examinations on the one hand with risk factors for the development of Parkinson's disease. And with this kind of approach, we are very confident that we can define risk populations, which then can undergo new treatments, because nowadays Parkinson's and Alzheimer's, we are very sure that if we don't intervene very early, we cannot fight this disease. And therefore, this is a major step forward as well. We do have such risk marker studies here at the EAN Congress. Important message from Lille, that also ventilatory disturbances like cardiovascular disturbances are occurring early. And we know that the olfactory testing is an early marker for Parkinson's disease, which has been confirmed in this clinical study from Russian Federation. But also when you look at MRI measures of the function of the nervous system, which can be done with resting state assessments, then you see that in that paper here from Messina in Italy, that already very early such resting state abnormalities can occur. And these are all pieces which will finally lead to a better picture how this all happens. And with this, I would like to hand over to you.